Hello, everyone. On this episode, we're going to talk about the use and abuse of performance enhancement drugs amongst gym goers and sportsmen. Stay tuned to find out all there is to know about it. Hello, everyone. My name is Ahmed. I'm the Chief Exec of Echelon Health, and with me, as always, is Dr. Paul Jenkins, Medical Director, endocrinologist, and consultant physician.
Hello and welcome.
There's been a massive rise amongst gym goers, hobbyists, people who do sport, about the use of performance enhancement drugs. And when we, the common word for it is juice, as it's called, and we want to talk a little bit about this because while the culture inside the gym might make it seem okay, it's fine, everyone takes it, and you might want to accelerate, as we all do, that ideal physique or look you want, there are lots of healthcare risk associated with that. However, there's also a lot of things that people use, like protein shakes and supplements, that are absolutely safe to use in moderation. But actually, what are the clinical and medical risks of using things like hormones, anabolic steroids, things like that? So it just happens we have an expert right here, Dr. Paul Jenkins, as an endocrinologist. This is your area.
Well,
This is your zone.
it's been a very long-standing interest of mine
Okay.
over the last 30 years of the endocrinology of sports, and the abuse of the various different substances.
Okay. I think it's becoming a lot more mainstream. It's not even viewed as something that athletes do. It's becoming a lot more mainstream. I mean, you see it because as an avid YouTube watcher that I am, it's very easy to spot people because when I was growing up, it was so easy to spot people who are on something. Now, I think it's completely distorted. People might look at someone who looks like 3 times the normal size, like Dwayne The Rock Johnson or the Liver King, and wonder if he's normal or if he's on steroids. Of course, he's on steroids. But so it's becoming a lot more mainstream and a lot more difficult to differentiate who's natural, who's not, and also what are the long-term effects? Because I'm pretty sure if you are on some of those drugs, you really don't have an idea of the seriousness.
Yeah, I would agree with all of that, Ahmed. I mean, I think you needed. There's a distinction. These drugs have been used for decades, used and abused.
Right.
Decades, yeah. And there's a difference between elite, semi-professional, sort of Olympian standard athletes who want to take a performance-enhancing drug that will give them that minutest slight edge, yes, and then the more recreational athletes. Yes, and then the gym goers who are doing it not necessarily for sporting enhancement, but to improve their perception of their physique looks. Yeah, I mean, and there's the enormous regulatory bodies against or trying to detect abuse in professional athletes, and we occasionally see all of the athletes who are caught banned substance in them,
Yes.
which are variously claimed to be various food supplements or applied to their skin accidentally or something.
Yeah, I fell on it by mistake.
Yeah, I mean, those are, that's one aspect of it. But I mean, amongst the amateur athletes, it's very, very becoming much more prevalent. It's almost endemic in American football.
Right.
They're trying to bulk up the college football.
Yes, of course.
Trying to bulk up, and a lot of the coaches turn a blind eye to it or tacitly endorse it.
Right.
You will get a performance enhancement if you're bigger, stronger.
Yes, of course.
In the UK, it's pretty prevalent amongst rugby, amateur rugby.
Wow.
And amongst certainly rugby union. There's some studies. The UK authorities believe around 35% of people take it. So I think one important caveat is it's not illegal to possess anabolic steroids.
It's not illegal.
No,
it's not illegal in the UK.
Yeah. So there's no penalties against you for it. There are a lot of rules in the various sports that if you're detected, then you'll be banned. Yes.
Yes.
But amongst amateur ones, they very rarely perform detailed testing.
And that just even compounds the problem more.
It can
And I'm
do.
not advocating for
No, no.
anything
No,
to
this
be
is
illegal, but it just compounds the problem. And I think it just moved from something that we used to watch on TV, oh my God, look at Arnold and his size, and wondering how on earth he got like that, to just mainstream people just take it.
yes, that is true. It is illegal to supply and distribute.
Right.
So they're categorized as Class C drugs. So if you're caught distributing anabolics or convicted, you can face prison sentences of up to 14 years.
Wow.
So that is a serious offence, but it's not illegal to own it yourself.
Okay. So can we talk about the whole spectrum of performance aids? Because personally, I've never taken either, so I wouldn't know. I maybe took protein shakes when I was young. So is it? It's everything. The spectrum is everything from vitamin D or a protein shake or creatine,
Creatine.
all the way to growth hormone injections.
Correct.
And I want to know, where is the line drawn? As this is safe, you can take it moderately and be fine, and then you're going into very dangerous territory here. And what is the danger to the human body, especially if I'm 22 or 23 and I'm taking those drugs?
Well, there are many categories, as you say. I mean, the supplements, the food, the vitamins are fine. Yes, and indeed, if you're deficient in vitamin D, and studies have shown that it offers a very significant performance enhancement. Both of neuromuscular contraction, sprint time, muscle contraction time. So and minimizing the risk of reducing the risk of injuries. So vitamin D is the easiest. High protein diet has been shown to increase your ability to put on muscle, to have an anabolic effect if you are training. And to some extent, creatine shakes and creatine supplements can do that. And they are all pretty safe. Creatine itself maybe causes a little bit of fluid retention to start with, but then your body adapts to it, and then that's pretty safe. So those, I think, of those supplements are fine. You then get into the pharmacology, the drugs, which are taken, and the big issue is the dose that they are taken on. Yes, we're going to, and the drugs are the steroids, the anabolic steroids. Yes?
Which
they're called AAS, Anabolic Androgenic Steroids.
Right.
So these are all derivatives of testosterone. Yes.
Okay.
So testosterone is the body's natural AAS, anabolic androgenic steroid. Yes. And then that can be adapted. You can chemically adapt it to modify it to increase its half-life, the time it stays in the body, and to increase its anabolic effects. So anabolic is when you put on muscle. Okay. Yes, that's your body enhances the musculature of it. The androgenic effects are the effects on the sexual organs and potency. Okay. Yeah. So people want more of the anabolic effects.
Yes.
Yeah. So that's a one class of drugs, and then the big issue, as I said, is the dose that people take that in. The second class commonly abused are then we call the peptide hormones. They're hormones, but they're not steroids. Completely different class of hormones, and one of those is growth hormone. Growth hormone is commonly used amongst athletes and gym goers. Amongst athletes, it's EPO, so erythropoietin. That increases, completely different class of action, but increases the amount of hemoglobin, the stimulation of red blood cells by the body, increases the amount of hemoglobin, which increases the amount of oxygen that your body will carry. So it's fantastic for long distance endurance, where you want to carry more oxygen. Then you've got the other class of drugs, completely opposite of the banned drugs, are ones such as beta blockers, yes, which block the effects of adrenaline on the body. So amongst athletes who are competing, things such as snooker, darts players, yes, shooting, where you want to avoid any tremor. So you want to calm the body down and stop any effects of the fight or flight. The anxiety of performance, anxiety.
Okay. You want stable hands.
Stable hands. Completely different to the anabolics, but in some sports, that's a class of drugs which are amongst the banned.
Wow.
Because these are giving you an unnatural advantage over other people.
Of course.
Then the other class of banned drugs are ones such as diuretics, where you excrete more urine. Yeah, they can make you lighter for some sports.
Right. Like weight sports. Yeah.
Yeah, and they can also counter some of the adverse effects of the anabolic steroids and growth hormone, which cause fluid accumulation.
Right.
So you can see there's a lot of different classes of drugs which have been, which are officially banned.
Okay.
So, but for what I think your main topic is amongst the amateur sort of weight, the gym goers.
Yeah.
Yes, amateur
Yeah.
sports. Predominantly, we're looking at the anabolic steroids.
Predominantly
Testosterone and testosterone-like derivatives.
Okay.
Yep.
So can we talk a little bit about that? Because I've heard crazy things like 2 injections in the day, one before and one after, things like that. What you explain briefly what those injections are. What happens in our body when we take those injections?
Okay. Well, there's two. People take injections and oral tablets and
Yes.
injections.
Yes.
The injections are intramuscular, so into a muscle, so they're quite deep.
Yeah.
Yes, it's not the other type of common injection
Under the
as
skin.
under the skin, which is much lighter, smaller needle. These need bigger needles and deeper.
Okay.
Yes, and also I will say that the testosterone is in oil. It's dissolved and formulated in oil, so it's much thicker
Okay.
and oilier. So you need bigger needles.
Right.
So they're not. So it's quite tricky to inject.
Yeah.
So let's put it into perspective. For my patients who are testosterone deficient, and we're going to talk about this, I think, separately.
Yes.
Another one, the so-called menopause,
Yeah.
male menopause, where testosterone supplementation is analogous to women with their hormone replacement. Yeah? You are trying to replace the natural amount, and we call it the physiological dose of testosterone. And just as a rough figure, that would be, say, 100 milligram dose a week.
100 milligram a week.
That
Okay.
would broadly give you replacement dose of testosterone.
Right.
Yes, and you can inject that once a week, a small amount. Yeah. When you're coming to the anabolic steroid abuse in the gyms, yes, the athletes use a term called cycling and stacking.
Yes.
So stacking is different types of steroid, at the same time. Yeah, so they'll use 1 or 2 different types of injectables, and then also additional oral agents.
Okay.
And the doses become truly pharmacological and astronomical. And it could easily be 1 to 2 grams a day of this.
I'm sorry. So you said how much do you give patients?
Exactly.
Who
We
are
would give 0.1 gram a week.
0.1 gram a week to someone who is deficient, just to restore them.
To restore them to normal. So if you're trying to get the anabolic effects, it can be up to a gram a day.
Up to a gram a day, and someone who already has normal testosterone because they're
Well, they
very
won't.
young.
They won't now. One of the side effects once they start taking the steroids.
Okay.
That will switch off your body's natural production.
Brilliant.
But it's still 10 to 20 times the replacement dose easily that people would take.
A day?
Yeah.
Okay, so let's...
Then this is of the big bodybuilders.
Yes.
Yeah.
So we started to talk then about what happens in our body. So I just took the injection. How does my body react to it? What does it do?
Well, in essence, it causes easier promotion of putting down muscle, building muscle.
Okay.
That's the beneficial effect. And I think it is important to say that this is only if you're still training. Yes?
Yes.
There is sometimes a slight misconception amongst lay people that people take the steroids and bam.
No, you
they
still
just
have to work
transfer.
out.
You still
Absolutely.
have to work out, and you have to work out incredibly hard.
Yes.
So a lot of the time, this allows people to train harder and longer.
But the size doesn't correlate sometimes with strength in those athletes.
Well, there's some suggestion, particularly with growth hormone, yes, that the muscles will become bigger but not quite as strong.
Yeah.
Weaker.
Yeah.
Yeah.
It's a bit like organic food versus...
I'm not sure. I mean, one of my... A slight digression.
An organic free-range chicken is much smaller naturally than the other white chicken that you buy from a supermarket.
Yeah, okay, yes.
The difference is hormones.
Possibly. I mean, one of my medical interests in endocrinology is natural excess growth hormone. A very rare condition called acromegaly, where your body makes too much growth hormone from the pituitary gland. In young people, forms giants.
Yes.
In older people, you get enlargement of all the organs. And one of them is your muscles do become, studies have shown that your muscles become bigger but weaker.
Right.
And
Okay.
growth hormone of those, excuse me, concentrations is, also abused in the gyms.
Right. So, okay, I took it. I've seen my muscles grow naturally. If I see a change very quickly, I'm going to stick to it. You said stacking, which we know is mixing different types of.
Yep.
But what's cycling then?
And then cycling is where you build it up, usually between 8 to 16 weeks.
Okay.
Can be different. So, there is a vast amount of pseudoscience around this, and in the underground world of gyms where they deal in the steroids and supply them, of what is, the right cycle, right stack, what substance you should take for how long. So there's no science behind it because there've been no studies and it's all illegal. Yeah.
Yes, of course.
So people do have their own beliefs, their own habits. Of cycling, and it's usually anything from 6 to sort of 16 weeks of you take the drugs, and then you gradually build up the dose, then you down, and then you're sometimes post-cycle, you stop, but then sometimes there's some maintenance post-cycle, to keep you at a low level before you start again, coinciding with training and stacking. So,
and does that eliminate the risks?
No.
When you cycle?
No. It's just,
but because see, that's what the common knowledge is. If don't take steroids, they're so bad. It's fine because I only take them for 3 months, then I stop, then I take them again.
No. Well, it depends very much on the dose you're taking.
Dose, right?
The dose, duration, the potency of them.
Okay.
Yes.
So even if they cycle or they stop for 3 months, then jump back on them.
Yeah.
Okay. Is it a felt side effect? Because that's the other thing. When there is a side effect that is internally damaging, but it doesn't manifest in certain level of discomfort or pain, people tend to dismiss it, right? Even though it is happening internally, but it's not presenting with any symptoms, so they're fine. Are steroids one of those things that you keep them, they kind of slowly damage you inside while you're not noticing?
Absolutely, they can do. Yes. High strength, the side effects of high strength steroids, yes, the long-term ones, is they thought it will change your lipid profile, can change. This is of pharmacological abusive dose.
Right.
Yes.
Yeah.
So it can change your lipid profile, so it predispose you to filling up of the heart arteries. It can make the heart enlarge, so you get hypertrophy of the heart, and there's an absolute increased risk of sudden death of cardiac events.
Well, there are so many examples of big, massive bodybuilders who suddenly died while they're even in their late 20s or their early 30s.
Yes.
That's the cause of it.
Yeah. So that's one major, probably one of the biggest side effects. It will definitely, it can change the mood. Yeah. People get agitated, more irritable, the so-called roid rage.
Yes.
Yes. Of getting quite aggressive on too much testosterone effectively.
Right.
Yes. I think it can cause disturbance of the liver. Yep. Those are probably the main issues relating to it. And then the biggest side effect is on the production of the natural hormones, natural testosterone.
Yeah.
So testosterone clearly is produced by the testes, yes, and it is under the control, like all the glands in the body, by the master gland, which is the pituitary. Pituitary is a tiny gland, size of a pea, your fingernail, about 5-6 centimeters back under your brain. Okay. Just hangs there. Sends signals to all of our glands. So it controls the thyroid gland, it controls the adrenal glands, controls the ovaries, makes the growth hormone, and it also controls the testes. And the testes do two functions. Yes. They produce testosterone and sperm. Right. Yeah. So there are two hormones from here called LH, luteinizing hormone, and FSH, follicle stimulating hormone, which tell the testes to make testosterone and sperm respectively. Yeah. Your body works very sensitive in a cycle to keep the level of all your hormones normal and appropriate for you. Yeah. So if you have damage to your testes, yes, which happens either at birth or during childhood, this chap will sense it, that there's not enough testosterone, so the level of these hormones would go up, trying to whip the testes to work harder. Right. Conversely, if you are taking too much testosterone, steroid hormone, this chap will sense it and say, "Hi guys, you don't need to work chill out.
We're getting it supplied
We're
from
getting it
outside.
elsewhere.
Uh,
Switch off. Go to sleep. Yep.
Switch off got us
Go to sleep.
permanently, or
So that's the issue. Go to sleep. Yeah. And the longer that you are on high dose of steroids, the deeper this sleep becomes. They really sort of not quite go into a coma, but they really switch off.
Yes.
Yep. And so, when you then stop, so you become, your testes basically become shrunk.
Yes.
So you get very small testes.
Yeah.
Yes. And you become infertile because they also stop producing sperm.
Right.
So that's one of the biggest side effects of it, and which many people don't fully understand. And I have a lot of patients, a lot of young men who come to me after they've taken anabolics in the gym.
Wow.
And then say, wow, what do I do? I know it's not good for me. And it's a challenge. So you can get them better, but it takes time.
So the people who actually might need it, or on lower natural testosterone level because they're past a certain age, they're not necessarily all on it. And the people who are the last people who need it in the world, who are in their prime, in their 20s or in their teens, who are going to the gym, working hard, they're taking it, and it impacts the rest of their life.
Well, I mean, usually the testosterone, the pituitary gland will wake up.
Okay.
It just takes time, and it can be many, many months, months to a year or so for it to wake up. Yes, and so, but you have got then that period in between time, if you stop the steroids, where you are then testosterone deficient and infertile.
Wow.
So that takes time. You've got to get used to those side effects of it, because having low testosterone, especially in a young man, has commonly causes significant ill effects.
Of course. And how long is that deep sleep? Weeks, months,
No,
years?
I said it can be several months to a year or so.
And it depends on the dose that they were
on
originally
the dose and the duration.
Okay.
Of what they were
what
taking.
about irreversible damage that can potentially come from these things? So I get the infertility, for a certain period of time.
Yep.
What about permanent damage to kidneys, to liver? Is there a permanent damage?
Probably less likely to the kidneys. Yep.
Okay.
The liver, certainly, if you take the oral ones. Some of the oral ones cause toxicity and increase the risk of liver cancer.
Wow.
Because of the way they're metabolized, and then the liver changes them.
Okay.
So that's why injectables are better, because again, too technical, you have something called the first pass effect. So they get into the blood without going past the liver.
They're directly injected into the bloodstream.
Yep. But then you're coming on to a very common one, in which, important issue is the use of the needles. Because if you're injecting, yes, and these are big needles, yes, there's quite a high prevalence of people reusing the needles. So they're less sterile. So if you're reusing them for yourself, yes, clearly needle share is not a good idea.
Yes.
There's a very high risk of spreading diseases, hepatitis, etc., HIV, which is why in a lot of the gyms they have needle exchange programs.
Yes.
So you can exchange them safely. Yes. But if you are reusing the needle yourself, there's a risk of infection. Because you're injecting deep, I've seen several cases of very nasty big abscesses.
Why would anyone use the same needle twice?
I don't know.
Himself or not? Like this is something that should never occur.
Or people, even if they're using clean needle, not using sterile techniques.
Yes, of course.
Yes, touching the needle. Or,
yes.
So that is a risk, yes, of the actual infection site. The other issue is where these drugs come from. Yes.
Okay.
Because they're not usually manufactured in pharmacological grade laboratories, because they're not medical use, other than testosterone. Yes.
Okay.
So many of them come from East Europe, Asia. Yes. And to be honest, they're sort of formulated in garage laboratories. So the purity of them is very questionable.
Okay.
They're not made to the strict pharmacological grade.
So it's not a drug that's available on the market that is being abused.
No. Other than testosterone.
Other than testosterone.
Yes.
But so also the one that's manufactured was probably slow release or have a much longer
well, they're more potent and half-life.
Yeah.
But so when they've done a study, and some of the authorities, there's a study, quite a good study from Holland, studied amongst the abusers.
Okay.
They set up a clinic there. They found up to around 50% of them, did not contain the drug that was labelled.
Wow.
That it was supposed to be.
Okay.
And in the minority of cases, contain no active steroid at all.
So what are they taking?
Well,
Injecting
it's
that?
just, I mean, they're injecting, they're paying for it, and then not getting what they think.
Right.
So,
Okay. I
so
mean,
it's a
what do you,
whole, it's a, yeah, it's true. It's a whole murky world.
it's an underground
It's a
culture.
very underground culture mixed with a lot of pseudoscience and a lot of adverse effects. And people clearly aren't counseled properly enough about it and to, as to what's the right thing to do and the safe thing to do.
What would you say to someone who's telling you, my son or my daughter, because a lot of girls and young women are also on um, performance enhancement drugs in the gym, maybe not
Well,
to the same
yeah,
extent.
the studies that I've come across have shown the prevalence is much, much less in women.
Fair
Now, in
enough.
female bodybuilders, yes, yeah,
Yes.
but amongst recreational gym goers,
Mm.
less so, because maybe for many women, it's not so attractive
Yeah.
or perceived to be desirable to
Mm.
have the big bulked and ripped look.
Yes.
So,
But there is
yeah,
there is a lot more acceptance now of that look for women as well.
yeah, yeah.
So if you know someone and they come to you and say, Dr. Jenkins, my son wants to take steroids or performance enhancement drugs or whatever to be able to go to the gym, to bulk up, and start his own whatever Instagram, YouTube channel, whatever it is. Would you advise them to do that?
No,
Is there even a safe way of doing that?
well, no, well, I'm sorry, I don't know. No reputable doctor would condone it. But equally, we shouldn't turn them away if they come to us in need, if they
No,
seek
of
help.
course not.
But no one is going to prescribe, no reputable doctor is going to prescribe these
So
for abuse.
do you think, and I'm not sure about that, I'm not sure if those young men and women know that they're potentially risking their life to look
Yeah,
bulky enough and big enough and have an 8 pack and all of
yeah,
that stuff and have that look of admiration. I don't know if they know that they're risking their life, or do they know and don't care because the recognition and the public endorsement
yeah.
from strangers and all of that fuels a sense of self-confidence.
Yeah, I can believe that. And look, I mean, we all, what young ones might seem a long time ago, but young
We
ones,
still
and
are.
you're carefree. You don't care. It's not going to happen to you. You take the risks. That's all. Just old people saying so. Just telling you
Oh, so
to
there's this
nick.
young invincible kind
Yes,
of
exactly. And that's
mentality.
we were all there. I mean, if you look back at, I'm not going into details, but some of the crazy things that one
Yes.
might have hypothetically
Yeah.
done. I mean, you certainly wouldn't want your sons doing it. I don't, but I can't tell them. Yeah.
I think there's a different culture now because I see some of those videos and I look at, there's this guy, I can't remember his name. I'm sure we'll have him on B-roll or something, but he's enormous in size.
Yeah.
And you might look and say, wow, that's admirable. But I just look at it and I'm like, you're 22.
Yes.
You still have about what, 60 years to live,
Yeah.
65
Yeah.
years to live?
Absolutely. Yeah.
What are you going to do
Yes.
for the next 65 years? How's that going to translate?
Yeah. No, I
So,
very much share those concerns, but
so there's also an effect that I see sometimes on people's skin, their complexion.
yeah, it can make them it will increase sebum, which is the oiliness of your follicles. So it gives you acne, gives you greasy
Yes,
skin.
it's acne, yeah.
Yeah, it will give you male pattern baldness, so
Yes,
receding
of course.
hairline. So
Yeah.
those two things, you get the testosterone is converted aromatase enzymes to estrogen. So you get gynecomastia, which is enlargement of the breasts. So
Okay.
often the patients will then take tamoxifen, which blocks estrogen.
Okay.
The patients, I say the clients, the subjects, the abusers, whatever
Yeah.
the term is, will take tamoxifen to block that. You get high blood pressure, so because of the fluid retention.
Yes.
So they often then take the diuretics. So you're getting a cocktail of medications, which is all in unsupervised doses and
Yeah.
sort of underground sort of sourcing. So it becomes quite a quite toxic cocktail you're playing with.
Which you don't have any experience to
Sure.
actually have the knowledge to make informed decisions about what you're doing.
Yeah.
It's just a recipe that's been passed by someone else.
Yeah, it's a recipe. And of course, don't forget that eventually a lot of these young men do find, or they do get married, want to
Yes.
start a family,
Yes.
and that's when the problems
Start.
And that's when they start coming to me and saying, whoa, what am I going to do now?
Okay.
Yep.
Now, in some cases, there is a physical change in bone structure. Like you notice it with people who are certainly on something, that their jaw gets a bit wider, their hands get bigger, or what looks like we're a little almost too bony and bulky.
Yeah.
What is that?
Well, this is with growth hormone.
So everything we've been talking about is
Is
still not the most dangerous thing.
No, I mean, anabolics are dangerous, but
No.
growth hormone, then too much growth hormone is this disease I described, acromegaly,
Yes.
which is a very rare disease, but is absolutely characteristic. And those features you display are absolutely part of it. So it causes prognathism, which is prominence of the lower jaw.
Yes.
And if you look normally, yes, and you open your mouth,
Yeah.
my upper teeth
Yeah. Have an overbite. Yeah.
Overbite of the bottom one.
Yeah.
If you have prognathism and for some reason the excess growth hormone affects the jaw, so it causes it to be prominent, the first thing is that you get they line up.
They line up.
And then the secondly is that your bottom ones overlap the top ones. That's a sign, and you get then separation, interdental separation, so your gums enlarge, so you get gaps between your teeth. Yes, so that's the first sign. You get the characteristic sign, you get broadening of the nose.
Yes.
So you get a wide nose, enlargement of the ears. Yes, and then you get prominent supraorbital ridges.
Yes.
So these are, for some reason, these are the bones that enlarge.
Almost looks like a more primitive human form.
Yep, you can, exactly.
Okay.
You get enlargement of the soft tissue, but part of it is the hands. So you get characteristic spade-like hands. We described it.
Right.
I had a patient once who was a car production worker, and his colleagues called him Spades because of his hands. That was his nickname.
Wow.
Because it became that. So those are, it predisposes to arthritis. And one of the signs in the gym is people complain that they're painful doing the weights.
Okay.
You get carpal tunnel syndrome,
Yes.
which is a compression of the nerve, so you get tingling in your fingers. So when they try and lift, they get the tingling of it, increased sweating. So these are actually characteristic signs, and gym abusers of growth hormone know it, and it's quite recognized.
So what's the difference then between the growth hormone and the anabolic steroids?
Well, they're two separate classes of drugs.
Separate classes.
Completely separate.
Okay.
One is a steroid, one is a protein, a peptide. Those are the chemical structures. The growth hormone doesn't have quite the same anabolic effect as the steroid, yes, but there is some evidence that they are synergistic. So if you take the two together, you get added effects.
Okay.
And growth hormone then also has we call it medically a lipolytic effect. It cuts the fat. So a lot of the bodybuilders want cutting agents to get rid of body fat.
There's cycles of bulking and cutting.
Yeah, and so they have more ripped look, and the growth hormone can help with that. Can help get rid of some of the fat.
And is that more dangerous or less dangerous than the anabolic?
It has its own risk. Growth hormone itself causes high blood pressure.
Right.
Yes. Can have some effect on the heart, weak heart. Yes. And the big theoretical stroke real concern about it is cancer, because it does what it says, growth hormone, so it increases the proliferation of cells, makes cells grow and divide more quickly.
And that includes bad cells.
And that can include cancer cells. One of my great research projects when I was a junior doctor was the instance of colon cancer in this condition of acromegaly. Growth hormone showed it was very significantly increased risk of colon cancer in patients with acromegaly, and by default, patients with take long-standing growth hormone. And we showed it causes a great increase in the proliferation and division of colon cells. So,
is there any situation or condition where you think it's okay to use those drugs?
well, I would say only if you are deficient in them, and then you're having, and I said earlier, the physiological replacement, getting you back into the normal range. And that's my basis of my sort of clinical practice,
Mm.
is restoring endocrinology back to normal and then getting you into the high normal range,
So,
but not super high, because then you
so,
have all the side effects.
so you're not a doctor who's just against anabolic steroids and all that. Actually, this is your specialty, but under a clinical and under,
Yes,
in a way that makes sense, that in a way that doesn't damage the health.
yes, absolutely. But
Because
that is,
a lot of young people who are watching will say, ah, well, they're a bunch of older people. Of course, they're going to say, no, he's a doctor for. But it's not just about that. It's,
yeah, but I mean, the most important thing is I would only prescribe these medicines and supervise them if someone was actually low in them to start with.
and that's the point.
And that's why I would not, and ethically and legally, and one would rightly so, be immediately struck off if you are prescribing these to people who are otherwise completely well in pharmacological doses
Of course.
for the, bodybuilding and the.
And that's why it's called hormone replacement.
Yeah, that's what I do, is
Therapy.
hormone replacement.
Yeah.
It's the same as female with the menopause.
Yeah.
You're replacing estrogen, not
Yeah.
too much of it. It's the same as probably the most common hormonal abnormality is thyroid disease, where your thyroid isn't working. You're replacing the thyroid hormone to normal levels. So,
But I mean, under no circumstances or no situation do you think that any abuse of such drugs, especially for the benefit of sports or going to the gym or looking bigger, is acceptable in any way, shape, or form?
I would say no. I mean, I couldn't condone that as a practicing clinical endocrinologist. No.
And what would be your advice then to, I don't know, 14, 15, 16 years old who wants to go to the gym and is looking around and is seeing all of those shredded, bulky monsters
Yeah.
and going, I want to be like them, and whatever it takes, I'll just do it. What would be your advice?
Yeah, no, I understand that and the temptation, but it is associated with significant side effects.
Do
I mean,
your
the
research.
people have to make their own decision. Yes.
Yes.
But as always, perhaps with life, you're getting out for free. If you want to look like that, there is a price to be paid for it.
Yeah.
Are you? So be very careful and do your research and be very open that that this can come at a price. It can be a very significant price. So I think that would be the my sort of take-home message. Yes.
Okay. I think on this note, then, it would be ideal to close the episode. So there you go, guys. Please, if you're considering that path, do your research, do a lot of research, ask professionals, don't necessarily ask, the rest of the gym bros, to be able to make an informed decision. If it looks good now, there's a price to pay, as Dr. Jenkins said. So it's all about whether or not you are happy or willing to pay the price long term. If you did like the episode, please like, subscribe, and ring the bell icon so that you're notified when we post a new episode. Thank you very much, as always, and we will see you on the next one.
Thank you and goodbye. And just think very carefully about going down that path.